All right, everybody. Well, it is 1:30 Eastern Time, so we're going to get started. Thank you so much for joining us today for the Thriving Thursday presentation. This month, we are going to be talking a little bit about why it is we partner with TouchCare and the benefits that they provide. We're really excited to be offering this to you today and want to thank you again for joining us. Just a reminder that the information in here is advisory, and before doing any activities, you can seek talk to your doctor. Obviously, though, because this is in regards to touch care, you don't have to talk to your doctor before you talk to touch care, so that's all right. So we are really excited today to have Dana Hanson with us. Dana's a client relationship manager with TouchCare. She has over 7 years experience in the employee benefits arena and has helped hundreds of human resource clients organize, understand, and promote benefit programs to employees. And at TouchCare, she is a day-to-day client contact, and she really helps to ensure that the implementation and ongoing engagement run smoothly and effectively. If you've ever joined any of the TouchCare presentations before, you may have heard her lovely voice, so we're really excited to have her with us today. Before I turn it over to Dana, I just want to remind everybody that we're really excited. On May 3rd, we are starting the first of a four-part series on stress management. And this one is on stress reactivity and, basically understanding why we react certain ways to stress and different techniques on how to manage those responses. So look out for the wellness newsletter on that. And then our next Thriving Thursday is going to be on reading nutrition labels. And that is going to be with me, and that is probably going to be quite humorous. So we hope you are able to join us for that. And now what I'd like to do is I'm going to hand the controls over to my friend Dana. And Dana, if you would like to take it away, we are all ears.
Great. And hi, everybody. And thank you, Sarah, for that wonderful introduction. We're excited to partner with Gatehouse Media, as always, to bring you TouchCare, which is your free advocacy solution. So if you're not familiar with us, today we'll really go through the ins and outs of how TouchCare can possibly help you, both on the medical side and figuring out claims and bills and administrative troubles, and just saving you frustration and time throughout the day so you can spend more time working and enjoying time with your family. So I will just move to the next slide. So overall, we are really just here to assist you. So when I say the word advocacy, what that means to us is just working on behalf of each and every member to find a solution to what they're experiencing. So we have a group of expert health assistants. We're all based out of New York City. They are the ones that are going to be answering your questions via email, phone, however you choose to get in touch with us, and working with you on a case-by-case basis to solve your issue. They all have really varying experience. Some of our health assistants have had clinical experience. Others have been on the billing side of healthcare. Others have been on the provider side, the carrier side. So a variety of different resources are available to you. And depending on what case you bring to us, we'll route you to the appropriate specialist. That being said, all the cases that we receive at TouchCare are, of course, confidential. We want to make sure that all of your PHI, all of your personal health information, all of the information that you're sharing with the health assistants, whether it's something in regards to a diagnosis or a problem with your family that you're having, or anything confidential like that, just know that we are a HIPAA compliant company, and we're never going to share any of that information with your HR team or with anyone that it shouldn't be shared with. Okay, and lastly here, TouchCare is 100% free to use. So this is a company-sponsored benefit. So you will owe nothing when you get in touch with TouchCare. So regardless of the complexity that you have us involved in, the types of questions you're asking, the amount of questions you're asking, we're never going to ask you for any sort of payment. We're really just there to assist you to find that solution. So how do we actually help? When I say advocacy, we really work on the administrative side of healthcare, and healthcare encompassing medical, dental, vision, coverage, whatever you're enrolled in, to make sure that we help you out and get the problem solved in a timely manner. So some of these categories could apply to, one situation. You could be facing all of these categories in one question that you have for us, but this really breaks it down in a way that allows you to see what we deal with on a daily basis and what we are experts in. So the first one here is benefit questions, and this is probably our number one category that we receive questions in. People just looking for answers when it comes to their coverage. So clarification of benefits, open enrollment support is a really big one here, helping members to decide between plan designs, and like I said, just general clarification using plain language, so not all the insurance jargon that you'll get from the insurance carrier. So some examples of benefits questions are, what is my hospital copay? Or how does my high deductible plan work for prescription drugs? Or how many nights am I eligible to stay in the hospital under this plan? Things like that just allow the member to feel better about the services that they're being provided with. The next category is cost estimates. So if you are on a higher deductible plan, or you do have a deductible and coinsurance applying to any of the benefits that you seek, this will really come into play for you. As we know in healthcare, a lot of times you don't necessarily get to analyze the cost before you get a service done. Either it's an emergency or you just don't know how to get that research. A lot of times members will just go to the doctor and don't find out what they're paying until after the fact when they get a bill in the mail. So we want to turn that around. We want to make consumers a little more savvy, and TouchCare can help you get there. So we do all the comparisons for you. We'll research different facilities in your area. For example, with an MRI, that cost can range from $500 to $5,000 in the same 10-mile span. So if you are on that high deductible plan and you want to get an MRI done, or something else that you have a little bit of time maybe to prepare for, reach out to TouchCare. You can analyze your options and hopefully save yourself some money out of pocket before you just go to the first facility you see. So really valuable research there, and I'll show you the report that you would receive from our health assistants in a few slides. Billing and claims assistance. This, of course, is another pain point in the healthcare industry. I'm sure everyone on the phone right now has received a bill or explanation of benefits in the mail that they're just not sure what to do with, or not sure if the codes are correct, or just don't know if what they're paying is correct. So we'll do a bill review for you. As long as you provide all of the documents for us, like the bills you're getting, your explanations of benefits, we'll connect to the carriers and your providers' offices and just make sure that what you're paying is correct. So we'll handle all appeals if they're necessary. We'll track the process of getting you reimbursed, so you don't need to keep up on anyone. We kind of keep you informed and do the fight on your behalf, and anything like that. So billing and claims assistance is definitely an area that we excel in. We actually have a billing specialist on staff that is really great and fights to the end to make sure that the employee is advocated for. And then lastly, finding, choosing, and scheduling quality care. So just doctor searches. So a lot of times we have members that are seeking doctors in network with a certain specialty, close to their home, maybe has a certain preference like male versus female or Spanish speaking, or whatever it might be. And a lot of times it's hard for them to do that research on their own. The websites are often outdated for certain carriers. You're never actually sure if you're getting what you're looking for. So TouchCare will do the doctor search for you. We do a really thorough job of researching not only the provider specifications, but also the quality of the providers that we're recommending. So if we do even a quick Google search, or look on HealthGrades or ZocDoc, whatever it might be, we can see the quality that's associated with both the doctor and the offices that the doctor performs in. So you'll get a thorough report. Again, I'll show you in a few minutes of what that looks like, just with recommendations for 3 different doctors based on what you ask us. All right, so these are both the reports that you would get. One on the left-hand side is the provider comparison, and then on the right-hand side is the cost comparison. Both are really similar in setup in that they have a little bit about the service request on the top there, a little bit about the employee's actual health plan, maybe what they've spent for the year. And then at the bottom, the provider comparison report has those three options A, B, and C, physician name, rating, any specifications, again, any preferences that the member has requested detailed out on that report. The difference with the cost comparison report, of course, is that costs are at the bottom there. You could see, in addition to the detail of the providers, the procedure price, so the raw price without any insurance being applied to it, the price that's negotiated with your carrier, and then ultimately your deductible and your coinsurance and total out-of-pocket costs, not only based on what insurance negotiated, but really diving into what you've spent already for the year and also what your out-of-pocket maximum is and everything in relation to the plan you're enrolled in. So really great data here. The provider comparison report, we can usually turn around within 24 hours or so. The cost comparison report takes a little bit longer, probably 48 hours or a little bit longer, just because we are using the information that we receive from the doctor's offices, the carriers. So we have to do all that research and compile it for you to make sure everything's accurate. All right, so a couple other different features that we have in addition to our core benefits, one of them being the benefits refresher. So if you're, 3 months, 6 months into the year after open enrollment, a lot of the times you don't necessarily remember what you enrolled in, or if something comes up, you want to just get a refresher on the different benefits that you are offered. So this 15-minute consultation gives you the opportunity to schedule an appointment with one of our health assistants to run through exactly what you're enrolled in. You don't need to do any of the research. We know what you're enrolled in. We can, pick out any information that you might want to know about your plan, and you'll take a intake form, or you'll fill out an intake form while you're making the appointment that has questions on anything else that you would want to know about during this refresher. So this gives the health assistant a little bit of an opportunity to research your questions before getting on the call and really talking through all of your benefits. The TouchCare open enrollment service is similar in setup to the benefit refresher, except of course this is really for an open enrollment review and plan selection. So during open enrollment period, a lot of times, you're confused about plans, or you don't want to ask questions maybe in a group setting, whatever it might be. You can schedule an appointment with one of our licensed health assistants, again, filling out an intake form during that appointment scheduling process and detailing out whatever it is that you have questions about when it comes to your plan selection. So maybe you weren't happy with what you enrolled in last year, or maybe you have a surgery coming up in the next year, or a maternity claim, anything like that can be detailed out in the intake form. And then again, you'll be able to connect with the health assistant at your pre-scheduled time, have 30 minutes to talk everything through, and then ultimately get a plan recommendation based upon what you spoke about with a follow-up from the health assistant. So really great service, really easy to use, and a live person over the phone that can help answer any of these questions and that are familiar with your plan selection. Okay, so our next service is something called RxCare, and this is a service geared toward those that are either in their mind paying too much for prescription drugs or looking for different options on how to receive their prescriptions. So this is another consultation that you should go through with our health assistant. You'll detail out what prescription you're on, what your dosage is, maybe how much you're paying depending on the plan you're enrolled in. And then the health assistant can do some research on the back end to see if there's any discounts available, either just generally or via mail order or generic versions. A lot of different options for them to look into just to make sure that you're getting the best price for that drug, and see if there's any other option out there that you can utilize. The RX Care is bundled with a PBM pharmacy benefit manager called RX Valet. So we work with them very closely. This does not run through your insurance plan. So if you do order drugs from the RX Valet site, it will be completely separate from your current prescription plan. It's on the outside. So this is a situational type approach, but if it works for you, if you're on a drug that you're overpaying for and you want to explore if there's something else out there, then we can definitely have that consultation. All right, so there's 4 ways to get in touch with TouchCare. Of course, via phone, email, and then we have a website and an app. The website and the app have a couple of different features that you can utilize, one of them being the health wallet. This is an area of the app and the website that is really just for the members' use. You can upload pictures of your ID card if you're someone that loses it often. You can upload any contact information for doctors or pharmacies, allergies, whatever it might be, you can store here. We also have your plan documents stored on our app and website. So if it was something in regards to a copay or something easy that you could look up if you know what plan you're enrolled in, then you can just pull that up directly in the app and not have to go through our health assistants. And then also on the app and website, you can refer easily back to any old cases. So you see the welcome screen and case log there. You can ask a new question by clicking that white bar at the top. Otherwise, if you wanted to go back and refer to some doctors that we recommended to you or an old billing issue, you can easily just scroll down and pull up all that information there. So any of these ways is completely fine. You'll always get one of our health assistants based in New York City. All right, so just to reiterate, if you haven't used TouchCare before, definitely take advantage of it. We are completely free, confidential expert advice service. We will help you through any administrative issue when it comes to your healthcare or your dental, your vision, whatever it might be. Just feel free to reach out to us and we can help you or point you in the right direction to get your issue solved. Our contact information is up here on the screen. You can call us at 866-486-8242. Email at assist@touchcare.com, or be sure to get in touch with us via the app or the website. We are available to you from 8 a.m. to 9 p.m. Eastern, and that's Monday through Friday. So if you do log a case with us outside of those business hours, just know that we will get back to you the next business day, but that we receive emails and inquiries throughout the weekend as well. All right, Sarah, I think that is it.
That is great, Dana. Thank you so much for all the information you provided. And I had forgotten to mention in the beginning, because we are in this webinar mode, if employees have questions, you can submit them through the question buttons on the right side there. So I'm going to open it up to any questions, or also let people know, or not or, but and let people know that if you do have a question, don't hesitate to, like Dana said, reach out to TouchCare directly and they can assist you, or you can also reach out to me, Sarah Norton, in the wellness team, or you can also send an email to our wellness email address. So I don't see any questions at this point in time. So what I'm going to do is I'm going to say thank you to everybody for your time. And Dana, I'm going to say thank you to as well. And I really appreciate the service that you and TouchCare provide.
Thank you. Yeah, thanks everyone for joining. Hope to hear from you soon.
All right, take care. Bye-bye.
All right, thanks.